This content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns. Have you ever noticed how the moment the temperature drops, your social circle seems to dwindle as everyone retreats indoors, bracing for the inevitable wave of sniffles and fevers? We have all heard the stern warnings from parents and grandparents alike: put on a coat, wear a hat, or you will catch a cold. It is a belief so deeply ingrained in our culture that we instinctively link frigid air with the onset of illness. But is there actual biological truth to the idea that the weather itself is the culprit, or have we been misattributing our seasonal misery to the wrong source for generations? Consider this: during the winter months, emergency rooms and clinics see a significant uptick in patients battling respiratory issues. It is easy to look at the frosted windows and biting winds and assume they are the direct cause of our discomfort. Yet, if cold air were the primary driver of disease, why do populations living in the most extreme Arctic environments not spend their entire lives bedridden with viruses? The reality is far more nuanced than a simple cause and effect relationship between a thermometer reading and a runny nose. While it is tempting to blame the chill in the air, modern science asks us to look closer at our own behaviors and the microscopic organisms that thrive when we shift our lifestyles. We often assume that the environment is acting upon us, but in many ways, our reactions to the environment are what truly dictate our health outcomes. Throughout this video, we will peel back the layers of this seasonal mystery, examining how viruses interact with our immune systems, and why human behavior during the winter months creates the perfect storm for illness to spread. It is time to separate folklore from physiological fact. As we transition into the next segment, we will dive into the specific biological relationship between cold temperatures and the way our bodies defend themselves against invading pathogens. To start, we need to address the most persistent misconception about winter health: the idea that freezing air itself is the culprit behind your sniffles. But here is the biological reality: temperature is merely the stage, not the actor. Illness is caused by pathogens, specifically viruses like rhinovirus, influenza, and respiratory syncytial virus. The cold air does not spontaneously generate a virus inside your lungs. It simply creates an environment where those viruses thrive. First, we must look at the behavior of the viruses themselves. Studies indicate that colder, drier air may stabilize the outer shell of certain viruses, allowing them to remain infectious for longer periods while floating in the air or lingering on surfaces. Second, we have to consider how our own bodies react to the chill. Your nose is your first line of defense. However, when you breathe in frigid air, the temperature inside the nose drops, which can actually inhibit these protective mechanisms. In essence, while the cold doesn't give you the virus, it might slightly lower the efficiency of your internal security team, giving a passing pathogen a better chance to gain a foothold. It is also important to note that our habits change when the seasons shift. These enclosed, poorly ventilated spaces act as incubators. When you combine reduced outdoor time with the tendency to gather in tighter proximity to others, you create a perfect transmission network for viral particles to jump from person to person. Understanding this distinction is empowering because it shifts your focus from fearing the weather to managing your exposure. In the next part of our discussion, we will examine the evidence-based habits that truly move the needle on your immune health throughout the winter months. While those habits are vital, they only tell half the story. It isn't the frost on the windowpane making you ill. It is the fundamental shift in how we live, breathe, and interact during the colder months. Think about your daily routine once the snow starts falling. This increased density creates a perfect pipeline for viral transmission. When you are in a crowded, poorly ventilated room, the concentration of airborne particles rises significantly. But there is a more subtle, biological mechanism at play regarding the air you breathe. Research suggests that the very act of inhaling frigid air can compromise your nose's primary line of defense. Studies indicate that when the air is exceptionally dry and cold, this defensive lining can struggle. The low temperatures may suppress the immune response of the cells within the nose, effectively lowering the drawbridge for viruses that might otherwise be neutralized before they take hold. As the days shorten, our exposure to natural UV light plummets. This is significant because sunlight is the primary catalyst for your body to synthesize vitamin D. When we spend the majority of our time shielded from the sun, our internal stores often dwindle, potentially leaving our systems less prepared to mount a rapid defense when we do encounter a pathogen. It is this combination, the increased viral exposure from indoor clustering, the physiological toll of dry, cold air on our nasal defenses, and the seasonal decline in vital nutrients, that creates the perfect storm. By recognizing these specific environmental stressors, you can start to adjust your surroundings and your habits to compensate for these natural disadvantages. In our final segment, we will break down the most effective, science-backed protocols to keep you feeling your best until the spring thaw arrives. Building on those environmental adjustments, we must now turn our attention to the internal signals your body sends when those defenses are tested. Distinguishing between a mild seasonal sniffle and a condition requiring medical intervention is a vital skill for navigating the colder months. When you notice that familiar tickle in your throat or a slight uptick in congestion, it is easy to assume the worst. Most of the time, these are signs that your immune system is doing exactly what it was designed to do, identifying a pathogen and mobilizing a defense. These symptoms are generally manageable with rest, hydration, and patience. However, the landscape shifts when the presentation becomes more aggressive. If you experience a sudden, high fever that refuses to break, or if you find yourself struggling to catch your breath while resting, your body is signaling that it needs external support. Persistent chest pain, wheezing that sounds labored, or a cough that produces thick, discolored mucus should never be dismissed as mere winter fatigue. These are red flags suggesting that your respiratory system is struggling to clear an infection, potentially escalating into bronchitis or pneumonia. Do not wait for these symptoms to resolve on their own. Early intervention can prevent minor complications from becoming significant health hurdles. In summary, the cold season is not a guaranteed period of illness if you remain vigilant. By prioritizing consistent hydration, supporting your immune system with nutrient-dense foods, and knowing exactly when your body requires professional medical guidance, you can maintain your vitality. Treat your symptoms with respect, listen to the specific cues your body provides, and never hesitate to seek expert advice when your intuition tells you that something is wrong. This content is for informational purposes only. If you found this information helpful, feel free to share it with someone who might benefit from these insights, and we look forward to helping you stay informed as the seasons turn.